Welcome to the January Roundup of Coffee with Compliance. My name is Colleen Patterson, and I'm the Vice President of Employer Services and Compliance at Savoy. I will be recapping all of the happenings in the legislative and regulatory landscape that's occurred over the last month, and of course is impacting employee benefits. So it's that time of year again, which means I'm going to talk about ACA reporting season. So the first thing I wanted to do is just kind of go over some reminders and some key dates. The first one is that ALEs must furnish the 1095-C forms to each of their full-time employees for the tax year of 2022, no later than March 2nd, 2023. Also, for ALEs that choose to file electronically, the 2023 ACA filing deadline is March 31st, 2023. ALEs that choose to do via paper, the deadline is February 28th, 2023. And as a reminder, employers who hire a resident of New Jersey also have New Jersey reporting obligations to the state, even if the company is not a New Jersey company. This applies to all groups, not just ALEs or fully insured or self-insured. If you have a group which isn't sure if they should report either federally or even with the state, we can assist with that determination. If you have a group that needs reporting assistance, we also have vendors that we can recommend and we can certainly refer to that can help with both state and federal filings. Now is also another time to start thinking about another important area, and that really has to do with plan documents, SPDs, and Section 125 plan documents. The reason for that is because we've all just come through fourth quarter, and now that it is the start of a new year and all of those plans that just wrapped up, it's just a reminder that the SPD and the plan document are required for every group, and the Section 125 plan document is required for every group which uses pre-tax deductions to pay for benefits. Your carrier will never create these documents, the responsible for creating and distributing them. If you're not sure if your group has an SPD plan document or even a Section 125 plan document, please reach out and we can help you with that process. My next topic today has to do with New Jersey small employer health plans, as well as individual healthcare sample policies, and they have been amended to cover abortion and gene-based cellular and other innovative therapies. Now, this is, again, is applying specifically to New Jersey small group. So this coverage is effective January 1st, 2023, and carriers have until April 1st, 2023 to update their actual contract language to reflect these amendments. Now, I'm not going to go over this in great detail, but I do want to let you know where you can find more information about this. You can take a look at the 2023 sample policy on the New Jersey DOBI website for details of what is covered. And the sample policy sections that you're going to look at is B, that's B as in boy, to E, E as in Edward. And you can find all of the things that you're going to want to know about these amended sections of the agreement, or excuse me, of the contract. You definitely want to do a search for the document for abortion and or GCIT to see all of the details surrounding these two topics. So moving along, the next item that I have, this happened actually the end of December, but I wanted to talk about this again because it's important because this has to do with January. So back in December, the Departments of Labor, Health and Human Services and the Treasury, of course we call them all fondly the departments, provided welcome relief in the form of an FAQ regarding the prescription drug data collection. And that's what we refer to as the RxDC reporting for 2020 and 2021 reference years that was due at the end of December, on December 27th, 22. The departments announced, though, that the RxDC data submission requirements has been extended until January 31st, 2023. In addition, CMS also noted that there will be no enforcement of penalties for 2020 and 2021 data submission for plans and issuers who make a good faith effort to comply. The FAQs relaxed additional components of the reporting, providing some welcome and certainly useful relief for group health plans, issuers, and plan service providers who have been struggling with complying with these new RxDC reporting requirements. It's important to note that although this is welcome relief, The agencies advise that they expect plans and issuers to continue to work in good faith toward full compliance with the reporting requirements. And as a reminder, the next reporting is due the end of June, or excuse me, the beginning of June. It's June 1st, 2023. The next topic that I have for you has to do with Congress passing a massive $1.7 trillion omnibus government funding bill, and that was titled the Consolidated Appropriations Act of 2023. And it included several things, and among the more than 4,000 pages is a provision affecting employee benefits. So that is that the CAA of 2023 extends for a second time the HSA relief, permitting high deductible health plans to provide first dollar telehealth and other remote care services for plan years beginning after December 31st, 2022 and before January 1st, 2025. So those telehealth or other remote care services do not need to be preventative or related to COVID in order to qualify for this relief. The practical effect of the relief is that high deductible health plans may choose to waive the deductible for any telehealth services through 2024 without causing participants to lose their HSA eligibility. The provision is optional, meaning that those plans are not required to waive the deductible that would otherwise apply to non-preventative telehealth services. The next thing that I wanted to touch on has to do here with New Jersey, and we've seen a couple of things about this in the news. So I wanted to touch on this just to clarify what is going on. That has to do with the New Jersey WARN Act. So what happened at the beginning of January, specifically on January 10th, when Governor Murphy signed Bill A-4768, amending the state's New Jersey WARN Act, which is officially known as the Millville-Dallas Air Motive Plant Job Loss Notification Act. It's quite a mouthful. The new bill permits amendments to New Jersey WARN to take effect on April 10th, 2023. And that's because it's 90 days from when the governor signed it into law. So the major changes to the New Jersey WARN Act include the following: expanded notice obligations, mandatory severance, lower threshold for mass layoffs, expanded counting and coverage of part-time employees, and expanded statewide definition of establishment. Now, I'm not going to go into great detail about that because there is more information that's available, but I did want to note that, yes, there was a change that doesn't necessarily require employers to go out and do anything specifically about it, but I did want to note that that has been something recently that's occurred here in New Jersey. The next topic that I have is the Department of Labor has published the annual adjustments for 2023 that increase certain penalties applicable to health and welfare plans subject to ERISA. So we have an article on our website that we are updating, and we publish this annually when this information comes out. And that has to do with penalties such as failure to file a Form 5500 timely and a whole host of other items. So keep an eye out for that. It will be posted to the site. Next, the Department of Health and Human Services, they recently announced the 2023 federal poverty level guidelines, among other things, and it establishes the federal poverty line affordability safe harbor for purposes of the Affordable Care Act employer mandate. So under the Affordable Care Act, the FPL can affect employer shared responsibility play or pay assessments in one of two ways. One, premium tax credits. So this applies to individuals with household incomes between 100 and 400% of the federal poverty level and potentially eligible and who are potentially eligible to receive premium tax credits for health care purchased through a public exchange. ACA full-time employees' receipt of subsidized exchange coverage can trigger player pay assessments. So this change in that amount could again have an impact on whether or not an employer receives a potential assessment due to an employee now qualifying for a subsidy when maybe they did not before. The other area where the federal poverty level can affect the employer mandate is the affordability testing. Employers can federal poverty level affordability safe harbor to test whether their lowest cost, self-only, minimum essential coverage with minimum value is affordable to employees. So again, just noting that that information is out in the event that there needs to be any adjustments. The updated FPL figures are effective January 12th and will apply for 2024 calendar year plans and non-calendar year plans beginning in 2023. Employers with calendar year plans can't rely on those higher federal poverty levels for 2023 affordability testing. The reason for that is because it didn't come out until January 12th, and calendar year plans would have renewed on January 1st. So that's why they can't utilize those numbers. Instead, for 2023 calendar year plans, sponsors must use the 2022 federal poverty level amounts. The adjusted affordability percentage applies on a plan year basis, not a calendar year basis. This means non-calendar year plans beginning in 2022 will continue to use the 9.61%, which was the affordability percentage previously, to determine affordability in 2023 until their new plan year starts. That's when they would use the new 2023 number. The next topic I have is a result of an interesting question that we've received a couple of times, and I thought this would just be important information to share with everyone. And it has to do with the Federal No Surprises Act and ambulances. So the Federal No Surprises Act, which as we all know is part of the Consolidated Appropriations Act, went into effect back in January 1st, 2022, and it prohibits balance billing of surprise bills for specific out-of-network services. However, the protections do not apply to ground ambulance services. It only covers air ambulances. The law instead requires a federal advisory committee to study the issue and recommend options to protect patients from surprise bills. A few states, though, they've actually enacted some form of balance billing protections on their own, but this results really in a patchwork of laws, and all the laws address all aspects of balance or surprise billing. So it's not necessarily cut and dry. In our area, I did want to note, though, in New York is one of the states that did pass one of these laws. So under New York state insurance law, an ambulance service provider cannot bill a patient who has comprehensive healthcare coverage for the difference between the provider's charges and the patient's health plan's payment, other than applicable co-payments, deductibles, or coinsurance. So per the law's ambulance mandate, an insurance provider or health plan is required to pay the usual and customary charge to the ambulance service provider unless a contract with a different negotiated rate exists. So this is true regardless of whether the ambulance service is a participating provider within the health plan's network. So since leaving protection from ground ambulance balance billing is considered somewhat of an oversight as a result of when this act was passed, we're likely to see some changes to the federal law in the future. So we're definitely keeping an eye on this now that this unintended consequence of the law, or at least an area that hasn't been clarified, is likely to be clarified in the future. So we will keep you posted on that. And then the last topic that I have for today, this is a good one, has to do with the national emergency. And that is that the national emergency permitted a 1-year extension of election and notice deadlines for COBRA and other group health plan provisions. So while the national health emergency is in effect, group health plans subject to ERISA or the Internal Revenue Code have to disregard the outbreak period, which is defined as the period beginning March 1st, 2020, and ending 60 days after the end of the COVID-19 national emergency, in determining the following periods and dates. So that has to do with the 60-day election period for COBRA continuation coverage, the date for making COBRA premium payments, the deadline for employers to provide individuals with their notice of COBRA continuation rights, also the 30 days or 60 days in some instances for the special election period to request enrollment in a group health plan, and the timeframes for filing claims under the plan's claims processing procedures, as well as the deadlines for requesting internal and external appeals for adverse benefit determinations. So the reason this is all really, really important is because the national emergency is expected to end on February 28th, 2023. And what that means is that it is all of these statutory timeframes that have been delayed or on pause will resume on April 29th, 2023, which is 60 days after the end of the national emergency. So come the end of April, assuming that the national emergency has indeed ended as it is expected to at the end of February, we will revert back to the statutory timelines. There will be no more one-year extension of COBRA enrollment or payment deadlines or any other HIPAA enrollment timeframes. And just as a reminder, there still is the public health emergency, and that is separate from the national emergency. The public health emergency is the one that regulates the no cost share coverage for things like COVID tests and related items. And that was renewed for 90 days on January 11th, 2023. So that means it's going to take us until April 10th, 2023, when it is expected to end as well. So it looks like at this point in time, come April, we will be reverting back to regular statutory practices, which means we all have to brush up on that again now that we have been 3 years in this delayed or paused environment. So that's going to wrap everything up for me this month. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use all of the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe, and thank you for joining me today.